I'm pleased to be here today with my colleague from New Hampshire to talk about fiscal accountability in the context of the healthcare reform discussion that we've been having. Back in Colorado, people aren't talking about far left or far right or Democratic or Republican. That's not what concerns them. What concerns them is that for the last 10 years, they've seen double-digit increases in the cost of their health insurance year in and year out, at a time, by the way, when their income has actually declined. You know, Madam President, even before we were in the worst recession since the Great Depression, which we're in today, during the last recovery, the Bush recovery, it's the first recovery in the history of the United States when median family income actually declined. It was, in effect, for our working families, a recession. And they're now having to recover not just from the greatest recession since the Great Depression, but from a 10-year period when they actually fell behind in terms of their income. And what was happening at the same time their income was going down? The cost of health insurance was going up by 97% in my state. The cost, by the way, of higher education was going up by 50% during the same period. What we have said to working families before this recession and now in the depths of this recession is that they're expected to do more with less. And we're threatened by a politics in Washington that for decades has allowed special interests to get in the way of our passing meaningful health care reform for working families and small businesses. At the same time, we have crippled our federal budget deficit and added to the national debt as we've been unable to deliver for families all across the United States. Well, today we are closer than ever to meaningful health care reform that lowers costs, reduces the nation's long-term deficits, and improves access to quality, affordable care for Colorado's families. With the release of the Patient Protection and Affordability Act, we have taken a major step forward. This bill will help put our nation back on a track to fiscal responsibility. There is much more we need to do, Madam President, to get us where we need to be. I'm the father of 3 little girls that are 10, 8, and 5, and I am desperate about the amount of debt that we have loaded up on our federal government, about the size of our federal budget deficit. And while reforming health care is not sufficient to fixing that problem, it is a very important step forward. Our nation's annual deficits are enormous and our debt is staggering. We must not, health care reform, as I said, must help solve that problem, not make it worse. I, for one, Madam President, have said from the very beginning of this debate that I would not support a health care reform bill that added $1 to our deficit. I'm very pleased to see that the bill that the leader has produced does not do that. We must pass effective reform that will rein in skyrocketing costs in both the public and private sectors and help to solve the fiscal problems that threaten our economy and our kids' futures. Without reform, if we just hold on to the status quo, if we listen to the siren call of special interests, out-of-control health care costs will place an ever higher burden on government expenditures and create structural deficits that could persist for decades as a drag on economic recovery and growth. Deficits and debt for as long as our eyes can see. Rising health care costs, especially Medicare costs, are the largest driver of our deficits. Our nation's health care spending today is 17% of our gross domestic product. It is slated to grow to over 20% in the blink of an eye. Healthcare will soon account for 1/5 of our economy. That might not be such a big deal if every other industrialized country in the world wasn't devoting less than half that as a percentage of their GDP to healthcare. It's like having 2 small businesses, one across the street from the other, and one is spending 1/5 of their revenue on their light bill, and the one across the street is spending less than half that. You don't need an MBA to know which of those small businesses is going to be able to invest in their business plan and grow. And if we expect to be able to compete in the global economy, we need to devote a smaller percentage of our GDP to health care. Since 1970, every year for almost 40 years, year in and year out, Medicare spending per person has risen by over 8% a year, and private insurance spending per person has risen by over 9% a year. We cannot expect reform to begin at the private or employer-based level. We must drive these costs down at the federal level by reorienting our Medicare incentive structure. The Congressional Budget Office Director, Doug Elmendorf, has said the, quote, rising costs for health care represent the single greatest challenge to balancing the federal budget. If you're embracing the status quo, you're embracing skyrocketing deficits. And the White House Budget Director, Peter Orszag, agrees, saying, quote, the single most important thing we can do to put the nation on a sounder, long-term fiscal footing is to reduce the rate of growth of health care costs, period. Meanwhile, the cost of health insurance is eating into family budgets faster and faster. About 20 years ago, Madam President, the cost of an average family health policy was $4,700 in Colorado, representing 12% of the average family's income. Today, an average family's health policy costs roughly $12,000, amounting to 20% of the family's income, going by 2016, if we do nothing, to 40% of their income. Middle-class wages are not even close to keeping up with these rising insurance costs. In fact, the median family income in this country fell by $300 as health care costs increased by 80% just while the last administration was in office. Looking outside the confines of the budget context, health care reform will contribute significantly to economic growth. Health care reform will rein in skyrocketing health care costs and achieve close to $2 trillion of savings through the entire health care system, savings that will result in real economic gains to families and businesses. The Council of Economic Advisors estimates that slowing health care costs will increase gross domestic product by 2% in 2020 and by 8% in 2030. After 8 years of irresponsible deficit spending, this legislation will be budget neutral and will put us on course to reduce the deficit over the long term. It's no wonder that people doubt that this is actually happening, because it's been so long since this body was actually able to do something that was deficit neutral. In this case, we're actually going to improve our deficit situation. The Congressional Budget Office report confirms the Senate bill is fiscally responsible and will reduce the deficit. Specifically, the report says that the bill cuts the budget deficit by $130 billion, cut the budget deficit by $650 billion in the second decade, extends coverage to over 94% of Americans, including a 31 million person reduction in the uninsured, costs $849 billion, and achieves almost $1 trillion in cost savings. Just this week, a bipartisan group of more than 20 leading economists released a letter urging passage of meaningful health reform. The economists said that our provisions to improve delivery system reform and slow the growth of health care costs, quote, will reduce long-term deficits, improve the quality of care, and put the nation on a firm fiscal footing. The challenges facing our health care system aren't new, Madam President. They are old. But if we fail to act, they'll surely get worse, meaning higher premiums, skyrocketing costs, and deeper instability for those Americans that have coverage. Today, thanks to a lot of hard work from a lot of people, we're closer than ever to enacting solutions to these problems and getting a finished bill to President Obama's desk as soon as possible. Now is the time for us to set aside the childish politics that put us here. Now is the time to ignore the siren song of special interests. Now is the time for us to create a meaningful health care reform for working families and small businesses all across the United States.